dramatic stories around non-allergic food reactions that are digestive that many of our clients have experienced. This is even without the food mapping data testing. This is the food mapping system training around digestion. I'll give you a great example here. Inessa, for example, came into the program, tons of brain fog, tons of hormonal symptoms. She has shared this on social media, and she had her gallbladder removed, right? And didn't realize, and a lot of people come in thinking, oh, it's going to be my food allergies, food allergies. She got educated within the first week around digestion and started to realize that that history of having had her gallbladder removed completely lined up with the fact that her fat digestion sucks, and immediately started to support her fat digestion. By the time she even got her food mapping allergy results, about 50% or more of her symptoms were already resolved within like 10 days of actually learning about digestion and starting to implement. That has nothing to do with food allergies. That's part of your education in learning how to diagnose and deal with digestion problems that are causing food reactions, right? I mean, there are hundreds of stories of digestive game changers for clients we've worked with. I mean, do any of you remember any of these stories or transformations or have cases that allude to that? Jason, Dr. J?
I was just going to comment, yes, yes to that. I think, just to kind of wax poetic on that, there are so many people that have gallbladder removals, in the United States. It's a common procedure these days. And then everything's supposed to be okay. And when you talk to the patients in the aftermath, I mean, you've done it, I've done it, thousands of people, and you say, did anybody chat with you that you might need that you do need some help with fat digestion? Your gallbladder's gone. Are you supplementing with X, Y, or Z? Are you taking that? And no, they're GI doctors. Nobody has talked to them about that. And these people suffer sometimes for decades. And then we just give them some fat digestion support. And like you said, in a few days, miracles. And it has, again, they keep thinking that they're allergic to these foods or sensitive to these foods. And it ends up being earlier than that. It's a digestive issue. So yeah, so many gallbladder cases.
Hi, I'm Maggie Yu, MD, and I'm a functional and holistic medicine physician and the creator of the Transform and Transform protocol. If you're interested in learning what are the root causes of all chronic disease, go ahead and click the link in the description where I have a power-packed 30-minute training that goes over what are the 5 pillars of Transform. Go ahead, click the link, and I'll see you in that training. Okay, so like that gallbladder thing, I did a whole training around how, my God, how many people have had the gallbladder removed? And the underlying problem in the first place is they can't digest fat. And then they remove an organ that they needed to digest fat. And then they don't tell them jack about how to support the fat digestion after that organ is gone. To me, is criminal, right? So in many of my trainings, I was just talking about people like, what's the one supplement that you can do to support your digestion, right? And this is why Digested is the #1 selling digestive supplement out of the store, and it's rebought over and over again because it works. And there's probably about, at this point, 50 testimonial videos of what a game changer this particular product has been. But to me, more important than looking at just product is really learning the dire pure lack of education that GI doctors and surgeons have, and frankly, functional medicine physicians, nutritionists, and functional medicine doctors have. The lack of that digestion is causing people to react to food in non-allergic ways over and over and over again. And it's really traumatic and life-altering for people. So digestion has to be learned and addressed properly.
Yeah, and actually this feeds in perfectly with what I was about to say, was that we'll have people come in and they'll say things like, I can't eat meat. Meat makes me feel awful, like I must be allergic to it. And no, they're not allergic to meat. In fact, they just don't have enough stomach acid, right? So once they start on something like Digested, they're able to consume meat. And, for most of them, this is an important nutrient that they've been missing as far as some really good solid protein. So, and many of them are just very happy that they can eat a steak again.
And I just want to jump in real fast too on that too. Just like the gallbladder being removed and no counseling going on from the provider, so many doctors out there, I mean, 99% plus of doctors out there always think that there's too much stomach acid, too much. It's really feed, PPIs and all these acid reducing drugs. When the reality is most people, when it comes down to it with testing, if we actually do some testing, are low in stomach acid. And that's why they're experiencing that problem with digesting meat and problems with feeling that fullness and that bulk, from eating. So again, it's just a lack of training all around. Like it's just a lack of training all around digestion and food.
Well, I'm going to actually bring up this point as an educational point. Everybody get ready to take some notes here, okay? So just thinking about the whole idea, one of the first steps in digestion is stomach acid. And you need stomach acid, to sanitize, right? We use vinegar to clean, right? So how important is that as a line of defense against infection? And then meanwhile, all of a sudden you're like, I get infections over and over again. And meanwhile, not even thinking, well, maybe my first line of defense with stomach acid is causing the problem. The other aspect of this is that when we experience heartburn, medical doctors erroneously think that that is from too much stomach acid, when it's actually a symptom of the opposite problem, which is too little stomach acid. And then here's the tickler, okay? Here's the tickler. Write this down, everybody. So when you go to the doctor with heartburn, they say, aha, too much stomach acid, when the real problem is low stomach acid. So they say, let's give you Nexium or Zantac or the red pill, this pill, to shut off the stomach acid, right? And maybe and then what happens when you completely turn off stomach acid? Well, that person that can't eat meat, do you know that the most important digestive step to eating meat, one of the most common symptom associated with low stomach acid is someone who can't digest meat properly, right? And even on top of that, do you know a lot of your vitamin and nutrients, talking about nutrient density here, back to the system, everybody, is that really critical nutrients like your iron, like your B vitamins, many of your vitamins, calcium, require adequate stomach acid to even absorb. And then we sit here and we're like, okay, well, let's say I have low stomach acid. No one told me about it. They put me on the purple pill. Now I have no stomach acid. And then now I'm not absorbing, let's just say, your B12 vitamin. Okay, after months and years of this, low B12, guess what it causes? Those who are alumni in chat, type it in chat. Okay, insomnia, depression, anxiety, palpitations, neuropathy, chronic pain, right? Infertility, miscarriages. And then we go see the doctor for all those symptoms when follow the breadcrumbs, and it goes back to you have low stomach acid. That's just one step. That's broken, right? That's the education that I find so invaluable that I never got in medical school. Did we get this training? What I just taught you guys right now, did any of you get that training in your medical training or your nutritionist training?
Well, yes, in nutrition
Yes.
training. Yes.
Yes.
You did?
That's what we help fill the gap here.
Yeah.
Doctors are screwed, man. So my whole point is that even I love what you guys just experienced here out there when you're watching. Did you learn something about that is completely out of the box, complete big aha moment that you have never heard from any of the providers that you've ever worked with? And are you all of a sudden making connections between food, digestion, vitamin deficiencies, and some of your symptoms that nobody can solve? Ding, ding, ding. To learn more about the food mapping system and my food mapping masterclass, click the link above or below this video.